In this 9-minute birth prep mobility flow, we're going to be targeting the bottom half of the pelvis where baby is going to be rotating and finishing their rotation by releasing tension within the pelvic floor and improving hip to pelvic mobility. Hey, my name is Gina. I'm a perinatal fitness trainer and birth doula and the author of Training for Two, which is a book on how you can use prenatal fitness to stay strong, pain-free, and help you prepare for birth. In this birth prep mobility flow, we're going to be moving through 4 different movements to help improve hip mobility. We're also going to be targeting the pelvic floor and improving hip to pelvic mobility, so how well the pelvis moves on the hip joint. We offer more intentional workouts like this in our prenatal fitness programs. We offer our prenatal fitness programs in 2 main formats. We have our app-based format, which is a list of exercise with short demo videos. This is going to be a more traditional style of workout delivery, which is great for somebody who likes to work out in a gym setting and wants to continue to work out with a barbell during their pregnancy, but also wants to prepare for birth. We also have our full-length workout videos in our prenatal on-demand program, which is a great option for somebody that likes to follow a video as they work out at the same time. Both programs come with birth prep workouts every week as well, both in an app-based format and as full-length workout videos. You can check out all of our prenatal fitness programs on our website at MamasteFit.com and use code YouTube10 to get 10% off any of our online offerings. So for this workout, all we're going to need is a bolster or pillow and a yoga block. So once you grab those, let's go ahead and get started with this 9-minute mobility flow. To start this flow, we're going to bring that pillow or bolster underneath the left thigh. So the right knee is externally rotated in front, left knee is internally rotated behind, and then I'm going to drive both knees down into the floor as best I can. So you may need to use your left hand to kind of push that right knee down. Place weight into the right hand, and then drop that right side towards the floor. And so we're kind of sagging here in the side body, stretching here, while actively pressing both knees down. And again, you can use that free hand to kind of press down into the right hand. Continue to press down on that left knee and pressing the right knee down. And so what this is doing is activating the left inner thigh, which tends to be a little bit weaker during pregnancy and just in general, to help turn it on to pull that pelvic cap backwards a little bit more. And then we're trying to activate this right glute more to help offload the pelvic floor. So we want the right glute to work a little bit more. So breathe into that side body, kind of hold into this position. Maybe we kind of shift that hip forward. Now go ahead and remove the pillow and we're going to come into some windshield wipers. So starting with that right leg still in front, we're going to windshield wiper the legs towards one direction and then towards the other. So this is going to help to improve hip mobility by changing from external to internal rotation. So begin to switch from side to side. If you need to put your hands behind you, feel free, or you can keep the hands in front of you, which will be a little bit more challenging, but more doesn't always mean better. So either hands behind or hands in front. And then when we come to the end range, you can come to a more upright position. Maybe you reach. And this is going to bring you a little bit deeper into that internally rotated or that back hip. So alternating from side to side. After this, we're going to add an extension, either supported or unsupported on each side to kind of continue to move into this hip mobility. About 10 seconds, we're going to start to extend at each end point. And now when you come to one end, we're going to extend in the hip, either unsupported, or you can place that hand behind you to extend to have it a little bit more in that hip flexor. So then we'll lower down, extend, switch, extend either supported or unsupported. I find the supported variation, I can get a little bit more into like that hip flexor area, but you may find that you want to do it unsupported. So it just depends on whatever feels good for you. So now we're going to come into a half lunge position. So we're going to come into an open hip position, kind of like a Captain Morgan's. And so we're going to keep that big toe down of that right foot. And then I'm going to think open in the hip. So I'm kind of shifting my weight towards this down knee, feeling this big stretch in this upper adductor or inner thigh. And so now just kind of sink into that leg and you kind of rock back and forth, really focusing on keeping this big toe and kind of arch down, feeling that stretch in that upper inner thigh. And then we're just kind of rotating towards that back leg. So this is helping to offload that half of the pelvic floor. For a lot of us, the right side tends to be a little overactive. And so this is helping to kind of let it release and stop working quite as hard. It's also releasing the upper inner thigh, which tends to be a little bit tighter for a lot of us as well. And we'll do this on both sides just so that you can explore the movement to see what feels a little bit different for you. So I'm using my free hand to kind of push into that knee to open, but still keep that big toe down. Let's go ahead and switch sides. So my right knee is down, left knee is up. I'm going to keep that left toe down as I open in the hip and kind of shift my weight towards this right leg. And then begin to rock back and forth into that hip. So as I press into the knee, I'm keeping that big toe down and just kind of rocking back and forth. So now I'm going to feel more of this stretch in the upper left groin adductor area. And just kind of explore how it feels on this side versus the other side. Maybe it feels a little bit tight on both sides. Now we're going to come to a tabletop position and grab on to your yoga block to do a hip shift. So with a hip shift, I'm placing my knee on an elevated surface, and then I'm going to shift my weight over to that elevated knee. So you can see that this hip is higher than this hip. So I'm going to shift my weight over and then begin to move through some pelvic tilts. So I exhale to pull belly to spine, which is going to round my back, and then inhale to look forward as I arch. So exhale, belly to spine to round, inhale to lower. As I round, I'm not clenching in my glute. It's more of my core engagement that's rounding my back. Feeling a lot of stretch and movement happening in that elevated hip. So this one is targeting that posterior pelvic floor or the back half of the pelvic floor on the elevated hip. So we had some movements that were targeting releasing the overactivity of the pelvic floor. And now this movement is helping to kind of stretch that back half of the pelvic floor. Let's go ahead and switch to the other side. So I'm placing my right knee onto the block now. Shift my weight over so like 80% of my weight is in that leg. And then I'm going to drop the belly to the floor to arch. And then exhale, pull belly to spine to round. So it's my core engagement that is rounding my back, not clenching in my glute. So feeling that stretch kind of in that deep hip pocket of the elevated hip. So this is going to be stretching that back half of the pelvic floor on that elevated side. Hip shifted exercises help to stretch the posterior pelvic floor, which can help to improve sacral mobility, so how well your sacrum can move, because all of the pelvic floor muscles are kind of attaching to your sacrum and tailbone area. And that concludes our birth prep mobility flow. In this flow, we were targeting hip mobility by improving internal to external hip rotation. We were offloading one half of the pelvic floor that may be a little bit overactive, while also stretching the back half of the pelvic floor that tends to be a little bit tighter for a lot of us. All of these movements are really beneficial to improving your pelvic floor function and release in preparation for birth, in addition to helping to improve pelvic and hip mobility, which can help you be more comfortable throughout your pregnancy as well. If you want more intentional workouts like this, check out our online prenatal fitness programs. Again, we offer in our app-based format and as our full-length follow-along videos. And so you can choose whatever works best for you. And you can use code YouTube10 to get 10% off any of our online offerings and our bundles, because you can bundle prenatal fitness with childbirth education and pelvic floor prep for birth as well. So thanks so much for joining us. If you enjoy this workout video, know that we release new workout videos every Tuesday. And so be sure to subscribe to get notified whenever we release a new video.